This is the PA Startup Podcast, episode number 9. This is the PA Startup Podcast, where we help pre-PA students, current PA students, and new grads start their careers as physician assistants. I'm your host, Chris Darst. We are glad you're here. Well, hey guys, welcome back to the PA Startup Podcast. The whole point of PA school is to prepare you for the PANCE exam. That is the PA National Certification Exam. It sounds funny, right? I mean, you're panicked about this test called the PANCE. And so people outside of the PA world are like, why are you so stressed about your pants? But anyways, that's a hashtag dad joke right there. So the PANCE exam is a big deal, right? It's a comprehensive, cumulative exam of everything you've learned in PA school. It covers every organ system, every pharmacology like drugs, treatments, things like that. And it's a big deal. So currently, for you new grads out there, you'll take it at the end of school, and then you take it every 10 years to stay certified. So it's important to stay up on information. For all of us out there, we are all in the same boat in that we have to keep up on everything. I mean, even when you are specializing in pediatrics or internal medicine or psychiatry, you still have to know the details for everything else that's out there. So my guest today is an old friend of mine. I met him years and years ago. He is a PA who's done a couple different types of practice since graduating, but he's always had a passion for education. So he went out and started Certified Medical Educators, which is a company that provides 3 and 5 day review courses for PA students and practicing PAs. So it's a board review course for anybody. And I was a conference attendee. I even spoke a couple times for him to do some pulmonary lectures and things like that. But a great guy who is passionate about PA education. He knows a ton about the exam itself, and he's just an excellent resource. So this is my conversation with Mike Nowak of Certified Medical Educators, and I'll be back at the end to fill in any gaps. All right, Mike. Well, thanks for joining us today. How are you?
Good. Thanks, Chris. Thanks for having me.
Yeah, you bet. So, Mike, I said in the intro already that you are the director of CertMed a continuing education company. Before we get into that, though, how'd you find the PA profession? Where'd you go to school? Give us a little bit of history.
Sure. Yeah. So I started out in undergraduate degrees in lab medicine, and I learned of the PA profession when I shadowed a PA after I met them transporting patients as a volunteer EMT and paramedic. So I remember taking a patient one day into the hospital, and there was a PA in the ER who treated the patient, and I had never heard about the profession. So I talked to her a little bit and shadowed her, and became quite interested with the entire concept of the PA. So from there, I applied to a bunch of schools, as most students do, and was happy to get accepted to quite a few. And I decided to go to St. Francis University. It's a PA program in Loretto, Pennsylvania. They've been around for quite a while, and I graduated now about 15 years ago.
Awesome. And then what was your first job right out of school?
My first job was cardiothoracic surgery. It was a love of mine that I became interested in completing my surgical rotation in PA school. And then I was able to set up my CT surgery elective rotation. And I did that back in Pennsylvania, Geisinger Medical Center, a big center in Danville, Pennsylvania there. And I knew from that moment that CT surgery was going to be a true passion of mine, and it was.
Awesome. That's cool. And then how long were you doing that?
So I started in CT surgery and completed a little more than a decade in total. And I finished my cardiac surgery career, that is, at Mayo Clinic in Rochester, Minnesota. And that's about the time where I think I met you years ago.
Yep, that's right. You had started doing conferences and had gotten pretty busy by then. You came to good old Lincoln, Nebraska, which why wouldn't you, right? Um,
You got it.
yeah. So, okay, how did you make the transition then? Because so for the listeners out there, Mike offers, and correct me if I'm wrong, 3 and 5 day review courses for the PANCE and PANRE exams. Is that correct?
Yeah, mainly we were focusing on our 3-day PANCE PANRE board review course. And this all began at the same time when I was working at Mayo. I'll be honest, ever since I graduated PA school, I've always had an interest in education. And I remember going back to not only my alma mater and giving lectures at the PA program when I could, but basically, even when we moved to uh, Wisconsin, Minnesota area, reaching out to those PA programs. And I've always been passionate about education. And then when I had some additional time, I kind of put all my passion into this PANCE PANRE board review company, which is hard to believe. It's been 10 years now.
Wow.
This year's our 10-year anniversary with the company.
Nice work. And I saw on your website you're going to Hawaii, right? For a
Absolutely. We're going to do a 10-year anniversary conference in Hawaii and offer some excellent CME for the PAs and students that want to come out.
cool. That's awesome. How many hours of CME is that?
So our normal 3-day conference gives a total of 26 hours of Category 1 CME. This 10-year anniversary, we're not going to keep people locked in a classroom for quite that long, so they can enjoy the beautiful beaches and ocean. So it's going to be a total of approximately 20 hours, but actually some of the CME will be earned on the plane while you're going to Hawaii and on the way back. So we're going to have about 12 hours of actual classroom work in Hawaii, and the rest will be on the airplane.
Oh man, great idea. Because what else are you going to do? You know, watch movies or something. But you might as well be getting it out of the way so you can enjoy Hawaii.
Absolutely.
That's good. Cool. Well, very good. And then do you do any other forms of CME in addition to the conferences?
We do some webinars. So once a month, we'll do a continuing education series on different topics that are important not only for board review, but for lifelong learning CME. We feel it's a great way to give these recorded webinars for the students and PAs who really want to not only benefit from the important board review topics, the ongoing issues that are occurring in medicine and surgery, but also help those that want to continue lifelong with some of the continuing education to help them 10 years later when they have to recertify.
Very good. Yeah, I forgot it's a 10-year cycle. I'm still on the 6. So we'll see. I forgot a lot in not that long, in 6 years. So I don't know, adding 4 years might be rough. So look for me in the audience here pretty soon.
You know, that's a true thing for all of us, Chris, because as we get older and most of us specialize today, and there are so many subspecialties that it gets harder and harder to put yourself back in PA school where you're learning all that didactic education all over again.
Yeah, for sure, for sure. And your conferences now, how many people are there? Like, what's the average attendee number?
So we have conferences anywhere from smaller groups to extremely large groups. I'd say our largest groups are around 300 to 400 PAs that come to them, and some of the smaller venues are closer to about 100.
Okay, but your first one, I think I remember you telling me your first one was like 2 people in a hotel, like meeting room or something, right?
Yeah, the first one was actually about 60 PAs and PA students. It was in Pennsylvania, but I think that was our second or third one. We started it in a different city, and all the startup, and new areas is hard. So yeah, I remember having a much smaller board table kind of conference of people that we had no more than 10 at that one.
One-on-one learning. All right, so let's jump in. Most of our audience is pre-PA, current PA, and new grads. And a lot of people, especially this time of year, are getting close to graduation. They're about to start studying for the PANCE exam. So I'd like to go through kind of like your highlights of your study tips. I mean, you've trained thousands of people now, and your pass rate is really, really high, right? Almost 99% or something like that?
Absolutely. We're extremely excited about that. We have nearly a 99% pass rate for everyone who takes our course. We're passionate about education, and we try to focus on the core components that really help people succeed best on this exam. Not to mention, we give over 1,000 questions, which helps to kind of look at the topics from different angles. And all of this combined is what makes us so successful.
Your tests are great. I've attended the course and I've presented at the course, and yeah, Mike knows what he's talking about, guys. So definitely a guy to follow. What would you say are your top study tips? How should a student who's, they've just finished all their rotations and things, their brain is full of all kinds of stuff, how would you tackle studying for the test, and what are your top study tips?
Sure. So for any student who's going to be graduating, and I say this not only as someone who's been involved for the last 10 years nationally helping PAs and PA students succeed on this exam, but I also speak to you as a PA professor, which I teach at a PA program currently. So I kind of look at this from all the angles, and I would recommend, as students are getting closer to the time of graduation, and as soon as they finish up all their final exams, they all know that they cannot sit for this PANCE exam until 7 days after program completion, which is usually their graduation date. So they know the earliest they can sit for this exam is 1 week after they graduate, roughly speaking. And with that time frame, I would first recommend that students sit down and develop a game plan of what they're going to do over the next 5 to 7 days to study. Some people are very well prepared by their PA programs, and they can sit for that exam exactly 7 days after the program completion. Other times, students may need to take a little extra time, maybe 2 weeks or so, to get caught up on some of the finer issues before actually sitting for that exam. And for starters, I would develop a kind of calendar where you're going to be breaking down what you're going to be studying on what days and for how long. Because we all know if you write something down on paper, let's say you're going to study for 2 hours cardiology this day and follow it up with 3 hours of women's health, and then go for lunch and come back and study on maybe infectious disease or hematology, you're more likely to follow that plan. And then you can enhance that plan after you sat through the day and you see how much time it really does take for each of those sections. So I feel the best way to initially approach this is to divide up your time, very similar to the NCCPA blueprint on how many percentage areas you're going to have. I'll give you an example. Cardiology has always been historically 16%, and pulmonary 12%, and GI 10%, and musculoskeletal 10%. Well, those 4 areas alone make up nearly 50% of your entire exam. So I'm not saying that you should ignore the other 50%, but in your total time that you're going to be studying, you definitely want to allocate it very close to this NCCPA blueprint.
That makes a lot of sense. I think I went through and figured out, maybe this was stupid, but I went through and I figured out what had the lowest percentage of what was going to be on the test, and I just didn't really look over it. I spent all my time on whatever was 92% of the test or something like that, and I knew that meant I was going to miss a couple questions, but I was okay with that so that I could kind of get the bulk of it. Is that kind of what you're saying, to focus more of your time on the higher percentages of content?
Absolutely. I always tell students that they're a lot smarter than they give themselves credit for. And we all doubt ourselves when it comes to these big exams. But if you've done what you've needed to do during PA school, and they all have because they've all got to that point of graduation, then focusing on the biggest area really is their biggest success. I always say after those top 4 areas, the 5th area that they should study is the one area that they feel weakest in. So whether it's neurology or endocrine or nephrology, that's what they should put all their eggs into, that next basket of what they're weakest in. And as you said, all the smaller areas after that, they just have to generally quickly look at any kind of either board review book, or what I really recommend, if they have time, is the reference book, Current Medical Diagnosis and Treatment. This is a very excellent reference book that you have to remember that the NCCPA and other organizations who write test questions are not looking at things from webinars or online blogs, but rather they're going to be going to the reference books like Harrison's, and Current is an excellent, excellent book that summarizes medicine. I like to call it the Blue Bible because they come out with this blue book every year. And a common question that sometimes people ask me is, how current does my current have to be if I'm going to look at it? And basically, I've asked this question to the NCCPA, and they've told me that test questions are generally about 18 months old because it takes time to generate questions and it takes time to get them into circulation. So students have to remember, if they've just completed their last year, their last 12 months or so on clinical rotations, learning of all the excellent new drugs that are out on the market from either drug reps or their preceptors, that if a drug has just come out in the past year or so, I would not focus on that at all for the boards, but rather focus on the gold standards and things that they've learned really in their didactic year of their program.
That's cool. So a lot of preceptors are, they want to stay up on current, literature and things like that. So what you're saying is that the new drugs that have been, maybe not out for 18 months or less, and then journal articles that might suggest a new gold standard, if it's been within that 18-month window, probably not what you should focus on. You should stick to the CMDT book or something else, right?
Absolutely. A reference book like the CMDT, which is Current Medical Diagnosis and Treatment, and I have absolutely no affiliation with that book, but it's an excellent, excellent resource and reference book that's a very good summary of medicine, I like to say. It beats having to pull out those big books that we used to have to do 20 years ago, like Harrison's. That's all we had. I remember having to do that in PA school. Well, it's so much nicer having this new current book that's a good summary.
Yeah. I remember having multiple volumes and hardcover, huge books, and like, oh man, but that CMDT book is awesome because it really does give you a quick, what would you say, 2 or 3 pages per, major condition?
Yes. And I know reading is daunting for some people, and it's tedious, and I get it. I'm not a big reader myself if I don't have to be, but when it comes to medicine and it comes to this exam, it's very important, and many students have jobs lined up or they've signed on the dotted line already for a contract, and we want to make sure that they succeed with this. And I feel one of the best ways is to do some light reading in this book and possibly attend a board review course. There's a lot of good courses that are out there, whether it's put on by a certain PA programs or national organizations like our certified medical educators. It's a great way for people to get what they really need to know in that short time frame, which we all, let's be honest, we're all extremely busy people, and between jobs and hobbies and families, it makes it harder and harder to find the time to study like we did when we were first in PA school.
Yeah. The quality of time spent studying is almost more important than the quantity, I'd say. And that's what I like about your review course and anything where it's immersive, but it's quick. I mean, it's 3 days and then you're off to the races. Are there any differences between the PANCE exam, the initial certifying exam, and then the recertification exam?
So the biggest changes are things that some people may not even be aware of, but in 2011, they actually decreased the number of questions in both tests. The PANCE used to be 360 questions, and they cut that down by 60 questions, so now it's only 300 questions. And the PANRE used to be 300 questions, and they've cut that down to 240 questions. As per the content, the blueprint is basically the same for both exams. And there have been some minor changes that you may have come across from the NCCPA. They came about a month ago. They fine-tuned some of the percentages a little bit on these areas, and they're mainly going to be affecting the PANCE, so for the students who are graduating. And I'll give you a couple very small examples of these. Cardiology that I told you, which has been historically 16%, I believe they've decreased that just a hair down to 13%. And a couple of the smaller areas like hematology, I believe that, and infectious disease, have both been increased to about 5%, and nephrology has also been increased as well. But generally speaking, maybe 1 percentage point here or there. I do recall GI decreased from 10% down to 9%. But for the most part, the blueprint is pretty on for all of the different areas of the PANCE and PANRE.
What's your advice for students, that are either on rotations or about to graduate? I remember being in school and feeling like I needed to study for my end of rotation exams that my school offered. I also needed to study for whatever rotation I was on, whether it be OBGYN or PEDS or something. And then also I had this looming PANCE exam at the end. Should people start studying for the PANCE earlier in their rotations, or would you say just get through school and then devote a week or 2 weeks or something to kind of general review before the test?
Great question, Chris. So, all the students need to keep in mind that they've been studying for the PANCE since day one of their PA program. And everything that they've done along that way is being applied to their education and to this possible test. But I know, like we focus on the immediate right in front of us. So if we are doing the cardiology section, it's kind of funny I say that because I'm going to be finishing up my last cardiology lecture in the PA school this Friday, and the kids have a big test on Monday on the entire cardiology section that we've been covering for 3 weeks now, that their focus is only on cardiology. And then as soon as that test occurs on Monday and they move on to the next section, which is going to be endocrine, they're going to put all their eggs in the basket and focusing on endocrinology. And then when rotations start, as you mentioned, whether it's OBGYN or psychiatry or general surgery, they're focusing on those topics, and they're worrying about the end of rotation exam, and on the next day they're starting their next rotation, and this goes on and on and on. But if they continue to not only, I try to recommend that students, when they're completing a rotation, so we'll say the general surgery rotation, while they're doing their general surgery rotation, they should, if possible, try to pick one other medicine area for that 4 or 5 or 6 weeks, however long they're there, and try to read up a little bit on that other topic. So let's say during their general surgery rotation, they're going to pick dermatology. So they're also going to be reading a little bit up on derm, right? And then their main focus is that surgical end of rotation exam, but their next rotation is, let's say, psychiatry. And during that rotation, now they're going to not only focus on psychiatry, but they're also going to pick another medical topic, let's say GI. And then if they continue to do that for all of their rotations, they're actually going to be ahead of the curve because they've not only focused for their end of rotation exam, but they're focusing a second medical topic, which will benefit them ultimately at the end of the year.
That's really good advice, because I think the one thing that surprised me about the test the most was that it's not like all the cardiology questions are in a row and all of the ortho questions are in a row. It's all random. So to switch your brain from thinking about, a gallbladder or an appendectomy or something like that over to hepatitis lab work, that was really, really hard. So I think what you're saying is very, very smart, because you can kind of get used to having your head in two areas at the same time.
It's hard to do because I remember, doing the rotations and putting all your eggs in that basket. And I tried as best as I could to read here or there, but there never seems to be enough hours in the day, especially when you're on a hospital medicine rotation or surgical rotation, when they got your work in 14, 16 hours sometimes. So I understand it's hard to do, but if you can do it, that will put you ahead of the curve. And then once students are nearing graduation, their mindset is going to be changing. And I do feel that many times students feel that they have to just study questions, that they feel that questions out of study books will help benefit them the most. And while I'm not against studying questions, what I feel the slight problem is that students or anyone puts too much time or effort into questions only. And I think that can be a little bit harmful if you were to just study questions. And sometimes at these conferences, I talk to the specialty PAs whether they're a neurosurgical PA or rheumatology PA or whatever, and we kind of get pigeonholed into our own specialty, which makes it harder for us to pick up that book and read up on things that we're not as interested in, whether it's dermatology or nephrology or endocrine or whatever. So sometimes we think that we're going to pick up a board review book and we're only going to do these questions, and that's the best way to ultimately help us with this exam that we have to take. And I'd have to say, after 10 years of experience of doing this with thousands and thousands of PAs and students, that I can tell you, I think questions need to be part of the solution of your study plan, but don't put all your eggs into one basket of only questions.
Yeah, I like getting into the flow of the questions, but I can see how that would be somewhat problematic because it's so specific to whatever that question is asking, that the outline form or like the manual that you provide conference attendees with the slides or an outline or something like that is I like the variety for sure.
Absolutely.
Of the people that fail, because people do fail the test, what trips people up? What's the problem with the people that fail? Is there anything that you can find is consistent amongst those that don't pass on the first try?
That's been a passion of mine to not only help everybody, but to really, really help the people who, let's say, have not passed this exam or have struggled for a while. Maybe they've not got their certification right out of school like their other classmates. So after talking to these people, and I really take time to meet with them, and when they finally kind of come to us to our conference, I invite them up and speak to me in the evenings, and I'll sit down with them over dinner or so, and I want to learn what they're doing, what they're not doing. And I can tell you, after polling the people who haven't succeeded, I give them the advice of, well, let me say it this way. If I could say the top two things that bother people most is if they're able to actually honestly kind of talk about what's going on. They often tell me that they have a lot of anxiety with test taking and they have difficulty concentrating. It's harder to focus as well as they did when they were in PA school early on. And this is mostly for the specialty PAs who have been working, 20, 30 years out there. The students usually do extremely well. And it's only the very, very rare student that has personal things going on in their life that sometimes it's overwhelming at that time. Maybe they have a family member who's ill or something else has happened that's kind of distracting them from their day-to-day abilities to think. But I'll be honest with you, students are extremely well prepared for this overall. But it's the experienced PAs who sometimes get pigeonholed with life and their jobs that it's harder for them to concentrate and focus. And I hear that increased anxiety a lot. So I try to get them to think about more of the actual exam day when they're going to be going into that and try to anticipate some of the stressors that could be there and come up with a game plan of how they're going to deal with those stressors. And I'm happy to give you some examples with a funny story in a little bit to break this up, but I'll come back to that story.
Okay, cool. Well, yeah, I think that test anxiety is real for sure. And especially when it hasn't been, when you're in school, you're kind of in the routine of taking tests over and over. But for those of us that have been out practicing, to sit for a 240 question exam I haven't done it for 6 to 10 years, depending on who you are. And my full-time job is not to be a student currently. So I can see how that can be a problem. One study tip that you had given me several years ago, and I've shared this with current students, I've shared this with my children, but you had said to read the answers first before reading the question. And I thought, well, that seems like a waste of time. But then I did it on my recertification, and all of a sudden I knew what choices I was going to have to pick from. And so I knew what the question was going to be asking versus reading the question first and thinking, oh, I know what this answer is going to be, and then looking and not finding it there.
I'll never forget the very first question they came up on one of my exams, PANCE PANRE. It was a very long question, and I was just so excited to start this exam, And I remember reading this long question, and let's say I came up with the answer, whatever it was, stroke, and then I get down to the bottom, and stroke's not one of the 5 choices. And then you kind of get that moment where you got to go back and you got to reread that long stem of the question to figure out what are they looking for compared to those 5 answers. So if you can prime your mind, get into that habit of looking at those 5 questions for just the answers for just a second, then that will help you when you begin reading that stem of the question to help delineate, you're ruling things out as you go.
Yeah, that was a amazing piece of advice. Do you have any other tricks, test taking tips or anything that you'd be willing to share? I don't want to steal your thunder.
Yeah. So this is one that's going to seem a little odd, but it definitely does work. And the story behind this, let me sum it up with this. A few years ago at our Chicago conference, I remember there were about 5 or 6 or 7 different people that came up to me during this conference, and some of them had taken other board review courses or so, and unfortunately they had failed their exam, whether it was a PANCE or PANRE. And they kind of came up to me and they said, hey, what advice do you have to help? And after so many of these people all came up during the lectures, I said, why don't we all meet in the evening? I said, we all have to get dinner at some point. We'll just go to the hotel restaurant and sit around the round table. I said, I need to hear everything that you're doing or not doing for your studying of this exam. And I remember listening to everybody's story at that time. And after that hour was done, I came up to the conclusion that honestly, we are all extremely busy people who do not have the amount of time that we really need to kind of study for this. So like I already told you before, many people just study questions only. And I told them at that moment that if you are going to study questions only, my advice to you would be to cover up the 5 answers altogether. Don't look at them at all. And treat it like a fill-in-the-blank question. And if you can answer that stem of the question with an answer, and then you remove your hand and that answer that you said is on one of the 5 choices, you pick that and you're done and you move on. Well, that night in my sleep room in the hotel, I remember thinking about this. And I said, why don't I push the envelope a little bit? And what I did the following day was I took 100 of our 1,000 questions and I converted them into a fill-in-the-blank test. Now, it's a lot harder to take a fill-in-the-blank test than a multiple choice test. But I have a little bit of experience of this being a PA student, because when I was in St. Francis, I remember every Monday morning, our academic director gave us a 10-question fill-in-the-blank test on anything from the week prior. So it could have been on anatomy and physiology or pharmacology, history and physical exam, or clinical medicine. It basically made you study on each weekend to prepare for this fill-in-the-blank, because they were hard, questions. And it gets your mind thinking a little bit different. Well, I can honestly tell you, when people come to our conference now and they see, because we don't tell them in advance about this one test that's a fill in the blank, but when they sit down and they take this fill in the blank test, first of all, I know I'm not making any friends that day at all, but there's a method to the madness, because what happens is it gets people out of their comfort zone and thinking a little bit outside the box. And whether they know the question or they don't know the question, that's not the goal of that activity. The goal is to get them thinking a little different. And then they end up paying more attention during the board review course, and they end up doing better, because they call us afterwards and they say, your test number 3, which was the fill-in-the-blank test, was even harder than the NCCPA, PANCE, or PANRE. And then I respond, you're welcome. Because our job is to get people more prepared for this exam. And if I can decrease the stress on the actual day of the PANCE and PANRE, then I've prepared you more for this exam, then I know I've done my job. And I can honestly say that we have nearly a 99% pass rate of everyone who takes our course. So I know we're doing something right. over the past 10 years.
Yeah, for sure. For sure. That's awesome. Well, very good. Anything else on your mind? Any other wisdom that you want to impart before we take off?
The one thing that I'd like to finish with is um, there have been some recent changes, as you know. You mentioned this early on that we've transitioned now from this 6-year cycle that you yourself are finishing up probably this year, next year with, into this new 10-year cycle. So all the new students who are graduating, they're only going to know the 10-year cycle. And my last piece of advice is, because the majority of PAs work in specialties, whether it's surgical specialties, whether it's medical specialties, no one is really the general practitioner anymore. Even in family medicine, if you work there, which I have in the past, we often get segmented into certain patients that we see, and we don't necessarily see all the different patients that come through. Some of us do, but for the most part, the majority of PAs, even if you work in surgery, no one does every type of surgery. You're either an orthopedic PA or a neurosurgical or cardiac surgery or thoracic or plastic or OBGYN or general surgeon. And the list goes on and on. But really, we get very segmented in our different realms of what we practice. So my advice to everybody is, please remember to focus on lifelong learning. And for the new students who are starting out in their career, yeah, the first year or two, you're probably going to go to conferences that are focused mainly on your specialty. So let's say you're a neurosurgical PA, you're probably going to go to those conferences to learn as much as you can, so you can best help your supervising doc and attending and consultants, the ones you work with. But after you've become comfortable in your area, I would advise people to become a little uncomfortable and go to a conference that you normally would not go to. Maybe go to a nephrology conference or go to a psychiatry conference, or at least do some continuing education, whether it's at a conference, a specific one, like our Hawaii conference, wink, wink, coming up in September, or any other conferences that are out there. There's some really good conferences at the state society level for PAs, as well as the national level, that I just want people to focus on general medicine, because before you know it, you're going to blink your eye and 10 years is going to be here. And there's nothing worse than, I'm most worried about this, that when that 10-year period comes, people are going to, come to a 3-day board review course, and it may not be enough to remind everyone of not only the things that they themselves forgot in PA school, but now to reteach them all the new medicine that came out in the past decade that they may not be used to because they're a specialty PA, let's say in dermatology. Well, all these new drugs that came out, whether they're nephrology drugs or cardiac drugs or pulmonary drugs, that's going to be a lot to learn in addition to all the stuff that they may have forgot a little bit from PA school when they were there.
Yeah, that's a lot of information. I mean, it was a lot for 6 years, so that's kind of what has me nervous about 10. But yeah, great tip. I really appreciate that.
And I'm just recommending that if possible, students or PAs just come to a board review course like ours every 5 years. I think that's not a lot to ask to get a comprehensive medical review of everything that you need in a 3-day time frame. And come to a conference that's in a great location. Maybe you want to go to Vegas or Nashville or Atlanta or Boston, Miami. Just pick a nice place for the every 5 years. And then when it comes up to the 10-year mark, you're really going to sit down and focus and focus and focus. So it's not the location that's important at that time, but it's really that you're going to sit down and take time to go through all the notes and do the questions and best prepare yourself for this exam.
Awesome. Well, Mike, everything that you've said has been gold. So thank you so much. This has been very, very helpful. Where can people find you if they want to check out CertMedEd or want to check you out on Twitter or Instagram, Facebook, whatever you're on? Where can people find you?
Yeah, so the best place they can find us is on our website, and the website URL is, I'll give you the long one and the short one. So our company name is Certified Medical Educators, and that's actually the long one. It's www.certifiedmedicaleducators.com, or the short one is CertMedEd. So www.certmeded, CERTMEDED.com. You can also find us on Facebook. We give weekly questions, at least 1 or 2 questions each week to kind of keep your mind stimulated. We always have some fun facts, some medical things. We give you a Medical Monday where we're giving you new top topics or FDA guidelines or contraindications or things that are coming out with devices. So we're trying to keep people up on a nice, friendly social media venue there.
Very good. Awesome. Well, thanks again. I will put links to everything that we talked about, the current medical diagnosis and treatment book, the NCCPA blueprint, links to Mike's Facebook page and his website. I'll put all that in the show notes for our listeners. But yeah, I think we're good, man. Thank you so much for taking time out to talk to me tonight.
Well, thank you again, Chris, for having me. It's been a pleasure.
All right, gang, there you have it. That is my conversation with Mike Nowak, a very valuable asset to the PA profession. So we thank him for his time. Show notes for today's show, as I mentioned, go to pastartup.co/episode 9, and you'll find links to everything that we talked about there, links to the current medical diagnosis and treatment book. And that book, actually, just a little aside, there's an overall book, and then Current also publishes specialty-specific stuff. So pulmonary, critical care, cardiology, dermatology, they've got a whole series. So if you are starting your job in a specialty, that is where I would point you to. Is if you're going to do pediatrics, find the Current pediatrics book, or if you're doing gastroenterology, definitely that is probably the best brief, pointed, but most effective overview of stuff there. So I'll link up to that book in the show notes. I'll link up to Mike's website for those of you that are looking for a PANCE or PANRE review course. I highly recommend it. He does a great job. Part of the program is you can get a copy of all the slides that he goes through, and that is what a lot of people use to study. So that plus the CMDT book, and you're golden. So hit us up on Twitter. We are at PAStartup.co. So it's PAStartup.co, all spelled out. And you can head over to our website, of course,